Minister, the first question is in relation to the very serious challenge that acute hospitals and our health services will face over the next number of months. Minister, we're hearing for some time now from Minister Donnelly that he will produce a winter plan. By the way, I want to wish Minister Donnelly well, and I very much hope that a negative result obviously comes back. But he has said he will produce a winter plan. This isn't just about a winter plan. It's about COVID and non-COVID and catch-up care, and a plan that enables us to do all of that. So what I asked in the question is, how is that going to happen? What supports and measures are being put in place, and what funding will be made available?
Thank you very much, Deputy Cullinane, for your question. If I could just say, as we all know, Minister Donnelly has been feeling unwell. He has been referred for a COVID test and is self-isolating, and we all wish him well. I will endeavour to answer the questions as fully as possible, and if any of the answers mightn't be sufficient, written answers can also be provided. In reply to your question, which is a very, very important question, resuming health and social care services and building health sector capacity and capability is a priority for the Government. Winter 2021 is expected to be partially challenging due to the presence of COVID-19 and the uncertainty around the level of COVID and non-COVID healthcare demands. As we face into every winter, it is always very, very challenging, but there is no doubt with COVID, Ceann Comhairle, it's going to be very, very tasking for the health service. The HSE is finalising a plan in line with Sláinte Care principles for delivering services in a COVID pandemic for the period to December 21 and incorporating winter 2021. The initiative in the plan is to mitigate the winter pressures, and it comes under 3 headings. So the first heading is community care. The second heading is acute care, and the third heading is assistance to support hospital egress. Timely discharge of care is hugely important from acute hospital settings. True flow in a hospital is hugely important so that there will be capacity at the ED side. This will include increasing hospital and community capacity, reducing unnecessary hospital admissions by enhancing alternative community care pathways, and enabling timely discharges from acute hospitals, and consequently reduce waiting times in hospital emergency departments. There will be a focus on targeted action to shift care to home and ambulatory care environments, especially for the high-risk cohorts such as elderly patients and those with chronic illnesses. Deputy, as you have known, the pandemic has borne down hardest on our older generation, and I've been an advocate for very, very many years to have the correct wraparound supports for our elderly generation living at home. And this is what this plan hopes to do, because obviously now older people are not in a position to go to daycare centres. They're not in a position to be out and about, so they need the support, they need the rehab, they need the reablement at home. Disability and mental health services, e-health and staffing will also be included in the plan. The resources for the plan will be sought as part of the 2021 estimates process. In advance of this, Government has allocated $600 million to support the early rollout of the winter-specific measures in this plan, $200 million up to Christmas and then $400 million thereafter. This will facilitate the commencement of priority measures from an operational perspective. A key action, Deputy, will also be a comprehensive flu vaccination programme. The HSE has placed orders for approximately 1.35 million doses of the quadrivalent influenza vaccine, as well as 600,000 doses of the live attenuated influenza vaccine, which will be made available to children aged from 2 to 12 years old inclusive. In relation to acute bed capacity, the programme for Government, Our Shared Future, commits to continuing investment in our healthcare services in line with the recommendation of the Health Service Capacity Review and the commitments in Project Ireland 2040. The Minister's Department is working with the HSE to increase both general and critical care acute capacity in hospitals nationwide. And if I could just say, Deputy, I just think it's so very important as we face into the winter that we are very, very conscious of the most vulnerable in our society. So we're talking about people with mental health issues, we're talking about the elderly, we're talking about people with disabilities, and especially those with acute disabilities. And I'd also like to mention carers as well today, who have been to the fore. Today I hosted a round table for carers this afternoon, and carers have been to the fore during the last 6 months, where they have had to cocoon at home with their loved one. Thank you.
Thank you very much, Mr. Cullinane.
Well, I'm very conscious of the most vulnerable people, Ceann Comhairle, and I'm very conscious that they are people that we have to protect over the next number of weeks and months. It's not good enough that the HSE is only finalising a plan, because we have an unprecedented crisis facing us. And if we thought we saw chaos over the last number of weeks and months, unless this government gets its act together, and unless there's a real aggressive, robust plan put in place to deal with what that challenge is facing our healthcare services over the next while, unless that plan is as robust as it needs to be, then, Minister, you're failing in your duty and the government is failing in its duty. We have a perfect storm coming at our health services. Our frontline healthcare workers need support. People need to know that they'll get treatment. People need to know that the capacity will be there. I didn't hear one word in your answer about how many additional beds will be made available, how many additional staff will be made available, what capacity we leverage in the private sector, how we're going to make sure that we can deal with both COVID and non-COVID care. All I got, Minister, is a statement of the obvious and not any plan. Yes, Deputy, you are right. We are living in unprecedented times, and I don't think a statement of the obvious is an announcement of 600 million to support people for the winter plan and into the winter after Christmas. You are quite right when you say bed capacity is hugely, it's the most important thing we have going forward now. And the whole purpose of this plan is to try and keep as many people at home, in their homes, in the community. The Department of Health is working with the HSE to increase acute capacity in hospitals throughout the country in the context of the current COVID-19 pandemic response. Funding was provided in March for an additional 324 acute beds. This brought the reported acute inpatient capacity to 11,597 beds, excluding critical care beds. This was an average of 11,000 inpatient beds open during 2020 up to the end of July. There was 304 general acute beds and 41 adult critical care beds available on Thursday, the 10th of September. So I repeat, on the 10th of September last week, there was 304 general acute beds and 41 adult critical beds available in the system.
David Cullinane.
Sorry, Cancora, but giving me a figure of 600 million and no detail of what that will mean. And I published a plan myself in the first week of August, and we set out what is necessary. The last figures that we got from the National Treatment Purchase Fund, Minister, showed 610,000 people, record numbers, waiting to see a consultant. It showed inpatient times were up, outpatient waiting times were up. Across all of the specialties, people are waiting longer. And there is no sense of urgency from this government. No idea what's facing frontline healthcare workers. The planning that goes into putting the extra staff and the extra beds in our hospitals, we know takes time. And coming with a plan in the middle of September, when we know the crisis is here and now, isn't good enough. When we've been asking the Minister for months to come forward with a plan. So it's not good enough to throw out a figure and say, well, we'll spend X amount of money at some point and we'll come in at some point. We had our plan today, Cancora, on living with the virus, the plan that was announced by the government. No government time to debate it. I hope when they do announce their winter plan, there should be proper statements in the door so that the Minister can be held to account.
Deputy, I take your point and it's well made, but you have to remember we are living in unprecedented times. We are learning as we go along. So obviously when the COVID pandemic hit in March and April, all our capacity was put into the acute hospital sector because that's what we had learned from seeing what was happening in Europe. Unfortunately, the pandemic bore down hardest on our older generation, and unfortunately we lost 985 people in our nursing home system. 54% of all those who had died to date were lost in the nursing home sector. So there is a huge amount of work being done, because testing, tracing and isolating is the byword of what we have to face going forward. And even though you say there is no detail, the detail will follow. I know, for example, that we are looking at doubling the amount of home care supports for our older generation. I know for a fact we are looking at rehab in the home. I know for a fact we are looking at reablement in the home to protect our older generation and to keep them out of the acute hospital setting. There are a lot of challenges ahead, but I do believe that we have a fantastic frontline service who will be well up for the challenge.
Deputy Michael Lowry has question number 32.
Minister, could I ask you if you can give a commitment, or if the government would give a commitment to prioritise increased funding for mental health services in County Tipperary and nationwide in Budget 2021? I asked that question in the context that last week the HSE Head of Operations said there has been a significant increase in referrals to mental health services as a result of COVID-19. Mental health services, as we know, are already overstretched before the pandemic, meaning that services now need substantial investment if people are to get the mental health supports they need when they need it.
Thank you. Minister.
And thank you for your question. I will be engaging in detail with the estimates process and seeking additional funding for all mental health services. The challenges of COVID and living with the virus has caused huge problems for those with mental health issues and challenges. In line with the programme for government, promoting positive mental health and reducing the burden of illness can have benefits for everyone. Mental health service users are among the most vulnerable people in Ireland, and I know you have been a long-time advocate for mental health service users in Tipperary. As you know, Deputy, I visited Tipperary on 3 occasions since I was elevated to Minister for Mental Health and Older People. So firstly, I went and I met with the Oireachtas members. Secondly, I went and I met with the Oireachtas members, and I also met with different support groups in Tipperary who are trying to support people with mental health issues. And on a third occasion, I went and I visited South Tip General Hospital, and I stayed there actually for 3 hours. Further to that, I also went and visited St Luke's Hospital in Kilkenny, and I visited the Department of Psychiatry to see exactly what the situation was there in relation to inpatient beds for those. So as we understand, people with mental health issues that need inpatient supports, they go from South Tipperary, they go to St Luke's in Kilkenny, and those from North Tipperary, from your own area, go to Ennis Hospital for those particular supports. I suppose, you know, I'm acutely aware of the challenge you have and the fact that you are very concerned that you haven't got inpatient beds in Tipperary itself. But I do believe that the capacity is there in both Ennis and in St Luke's in relation to bed capacity. For example, last year, the capacity in the DOP in St Luke's was at 85% for the whole year.
Minister, I certainly appreciate and acknowledge your commitment to improving mental health services in Tipperary, and I think all of us recognise that. The problem is, have you a budget to deliver? I have no doubt that you're well-meaning, but I'd like to remind you that Tipperary is a large county with a population of 160,000 people. The distance from the northern end, from Laura to Carrick-on-Shore, is 130 kilometres. The mental health strategy and the policy enforced on Tipperary by the then Minister, your predecessor, Kathleen Lynch, deprived our patients of access to vital services. The people of our county with mental health issues are at a disadvantage. We are left without a single acute mental health bed. We have no proper respite mental health beds. Our access to crucial services is, as you say, split between Ennis and Kilkenny. The system hasn't worked for Tipperary. It's a failed policy. The delays and neglect of our mental health patients is indefensible. The extent of the deficit in services, in my view, is bordering on irresponsible, and you need a budget minister to correct it.
Thank you.
Just refer to the budget first, Deputy. So Budget 2020 saw the Government continue its commitment to mental health by increasing funding by 39 million to 1.026 billion. Now this represents an increase of over 315 million, or 45% since 2012. Admittedly, we have a long way to go yet, and I'm very conscious of that. So I have 3 priorities when it comes to Tipperary. So the first thing I want to say is my priority for Tipperary and my commitment firstly is to have Jigsaw opened in Thurles before Christmas. I have given you that commitment and I will follow through on it. My second commitment to you, as I gave previously, is, and this is where the budget estimates come in, I'm looking for 2 million under the budget estimates to redo the crisis house in Tipperary, which I believe is not fit for purpose. And thirdly, under share and division, I will be tasking the National Implementation Monitoring Committee to complete a review of mental health bed capacity throughout the whole country, because we have huge issues in the South East, not alone in Tipperary, but we have the same issues in Waterford and Wexford in relation to capacity, and that's the first thing I want to look at, bed capacity, and when we'll work
Deputy
from there.
Lowry to conclude.
Minister, the reality is that the mental health budget has remained at 6% of the overall health budget for many years now. There are fewer staff working in the mental health services. now than there was in 2008. And in January 2020, there were 10,642 individuals waiting for 12 months and more on waiting lists. And we also had 2,000 children and young people on the waiting list. And in regard to Tipperary, what I have to say, Minister, is at a time when we have dramatically increased levels of stress, anxiety, depression, isolation and loneliness, the lack of access to mental health services is inexcusable. And at a time of huge vulnerability, our mental health patients in Tipperary, they're reaching out at the moment to an empty space. The lack of access to professional care, to guidance and support is not acceptable, and it must be seen as a priority for you, Minister, and for this government.
Thank you. Minister.
Thank you, Ciarán Comhairle. Deputy, when I visited the emergency department in South Tip General Hospital, I was delighted to meet the team that operate there. So all mental health patients attending the ED are triaged in accordance with assessed clinical need, with the objective of referring them as soon as possible to the HSE mental service once they are discharged from the ED. The ED has a 24-hour mental health nurse liaison service for mental health patients, 7 days a week. This was put in place in 2012 when St Michael's closed down. And I know there are many other areas in Ireland would love to have a similar supports. I spoke at length with the mental health liaison nurse on duty, who was one of 3 that delivered this 24-hour service. We discussed many issues that were raised with me previously, including voluntary and involuntary admissions, transfer of service users and assessment, and to the DOP, along with 2 rooms dedicated for that purpose. So there actually are 2 rooms there, one for the nurses, and there's another room as soon as you enter into the ED and you're after being triaged. But I will give you a commitment, as I gave previously. I will continue to work with all the deputies in Tipperary to try and improve the mental health services there.
Minister, this question is in relation to testing and tracing, and in just this few seconds that I have, just to make the point that testing and tracing is the foundation to getting everything right over the next number of months. We've been asking the government now for some time to ratchet up and ramp up testing and tracing. In fact, the calls that we made were rubbished by the Taoiseach and the Taoiseach in the past. They were dismissed, and yet we're now seeing that we were right and we're paying the price for the fact that we don't have enough capacity. So my question is, what action is the government taking to ratchet up capacity in testing and tracing?
Minister.
Thank you for the question, Deputy Cullinane, and I think it's a very important question, because the whole premise of COVID is test, trace and isolate. A comprehensive, reliable and responsive testing and tracing operation is central to our public health strategy. Capacity has been in place since early summer to test 15,000 people a day. While the system did come under pressure in recent weeks, overall the system is working well and is proving central to our public health response. Rigorous contact tracing, automatic testing of close contacts, serial testing in high-risk environments and large-scale testing in outbreak situations means we are proactively finding more cases than we would have previously. Today we learned that there are 357 cases, and unfortunately 3 people have lost their lives today, and I'd like to offer my sympathies and condolences to their families. In recent weeks we have needed to flex resources up significantly as demand has increased. We are testing more people than ever before, with over 71,000 tests completed in the weekend in the 12th of September. Community testing has increased in line with a steady increase in the prevalence of the disease, and the HSE has deployed additional resources to meet the increased demand. This included the opening of additional community testing centres and mobile pop-up testing units, significantly increased contact tracing teams and increased laboratory testing. Our testing strategy and infrastructure compares well internationally. We are in the top third of the EU countries in terms of tests completed as a percentage of the overall population, and capacity levels and turnaround times are similar to many countries. We are also going further than many other countries in pursuing a robust testing strategy, which includes testing of close contacts and serial testing in nursing homes and food processing facilities. That is not to say that we can't improve further. We can always improve, and I acknowledge that the system has come under huge strain in the recent weeks. The HSE is now finalising a further service model for testing and tracing. The plan includes the recruitment of permanent workforce, which have already commenced, and a range of other service improvements which will be rolled out quickly. Transition to the new model is underway and will continue throughout autumn.
Minister, the plan that was announced today will only be effective if we get testing and tracing right. And I can tell you now, it won't be worth the paper it's written on if we continue with the failures that we've seen in recent times. That's not to say testing hasn't been happening, it has. But it hasn't been happening at the rate that it should be happening, and it isn't quick enough, despite all the promises that were made. And I made the point to you, we have been calling for this for some time, and those calls have fallen on deaf ears. We saw what happened in meat plants. We're seeing now what's happening in Dublin. Testing and tracing needs to be used to hunt down this virus. That's what it needs to do. The government said it could reach 100,000 tests a week by the middle of May. It hasn't done so. You're now talking about hiring more staff. Well, why wasn't that staff hired last month, 2 months ago and 3 months ago, when we, on the floor of this Dáil, were raising these concerns? When my party leader raised them directly with your party leader? When my party leader raised them with the Taoiseach when he was Taoiseach, and the Minister for Health and the former Minister for Health? And only now the government is getting around to putting in the extra capacity.
Right,
it's not good enough, Minister, and it undermines confidence in the government.
Thank you, Deputy Cullinane.
As I've said, 71,000 people were tested last week. We have had to considerably ramp up testing in the last 4 to 6 weeks because COVID has changed. COVID is changing. It's more prevalent in our communities now. So earlier on in March and April and into May, I suppose, we were testing a lot of people, but then we managed to flatten the curve. The lockdown worked. People stayed at home. People didn't move beyond 2 kilometres of their own location, and it actually worked. But as soon as we started to open up society again, COVID came back. COVID is not going anywhere. It's just lying dormant. It's there in our communities. 30 community testing sites are open and 3 pop-up testing sites have been mobilised in Limerick, Tala and Carlow Kilkenny. But we can't, you're right, Deputy, we can't rest on our laurels. Testing and tracing and isolation is the way forward. It is the only way to flatten this virus. And I have no doubt the Minister will put every effort he can in to ensure that we will ramp up capacity wherever it's needed. But 71,000 people were tested last week.
But, Minister, testing and tracing is the way to stay ahead of the virus,
yes,
to get ahead of the virus. And of course, when people were in lockdown, the numbers were going to go down. And it was pointed out to you, which is my point, that when the economy started to reopen, we were going to see more community transmission and the virus was going to look for places to spread, and that's what happened. And the way to prevent that, because it's prevention is what we need, is that you ratchet up testing and tracing. You failed to do it in nursing homes originally. You failed to do it in meat plants. In your own constituency, in my constituency, you might have heard of a cluster in a meat plant. You might have seen on your own local newspaper stories of a bus packed to the rafters of people going to work. This is what's happening, and the testing wasn't happening in these areas, Minister. So we need to get, and I'm holding the government not to my standard, to the standard that you set, that the government set, 100,000 a week. You've never done it. And only now you're telling us you're recruiting the staff on the day that you launch a plan on how to live with the virus. And for me, that's simply not good enough.
Well, I think it's interesting to point out that testing in nursing homes, testing of staff has been ongoing for the last 2 months now and has proved very, very effective. And also in relation to the meat factory that you mentioned, I actually have 2 family workers, 2 family members who have worked there for a very long time. And they were actually tested last Thursday, even though there was a whole hullabaloo going around that there was no testing in meat factories last week. Dawn Meats in Grana last Thursday, over 800 people were tested. We have to deal with the facts. The HSE is adding swabbing capacity in Dublin, Wicklow, Kildare, Louth and Galway. Pop-up remains in place in Limerick, Carlow, and there are additional staffing and longer opening hours in many sites. We also must remember, Deputy, that at the start there was many frontline workers who were redeployed to test, trace and isolate because the ordinary person didn't understand it. People needed to have a medical background. We know so much more now, and permanent people will be put in place. But as the virus was suppressed, as we flattened the curve, these medical people had to go back into the acute system to deliver non-COVID services.
Question 44, Deputy Cullinane again, you're very lucky in the draw.
Thank you. That's what happens when you win 37 seats.
What did you say, 37 questions?
Corley, in relation to this question, Minister, in the last budget, the government announced that they were going to extend the medical card to 7- and 8-year-olds. They were going to extend medical card eligibility for the over 70s by changing the eligibility criteria and the thresholds for entry. And they also promised as well that all people with a terminal illness would have a medical card, that would be examined. That was in the programme for government. We passed a bill in this House a number of weeks ago. There still has been no progress on these issues, and I can tell you that my constituency office is inundated with people asking, when is this going to happen? And you have the floor now, Minister, and the opportunity to provide that clarity.
Thank you, Deputy, for keeping me on my toes today. Firstly, I want to acknowledge the difficult year older people in our society have experienced as a result of COVID-19. They have shown tremendous resilience in helping to fight the spread of COVID-19. The issue that you raise is something that is very close to me as Minister for Older People and Mental Health. So Budget 2020 provided for an increase in the medical card thresholds for persons aged 70 and over. So this meant the threshold is currently €900 for a couple, but it would increase to €1,050. And it was intended that this measure would be implemented from July. It was not possible to legislate for the necessary amendment to provide for this measure until there was a fully constituted Dáil and Shannon. So you are quite correct. The Minister for Health, Deputy Donnelly, was very pleased that his first piece of legislation was the Health General Practitioner Service, an alteration of Criteria for Eligibility Act 2020, which provides for the increase in the income thresholds. Now, when that was introduced last year, it was introduced in the budget if there was sufficient savings made in the health budget this particular year. As we all are aware of, that isn't possible at the moment. However, these savings have not been realised as the pandemic has placed a significant demand on public finances, a substantial proportion of which has been allocated to the health system. In that context, decisions on the associated funding and a potential implementation date are being actively considered. Now, I have sat down with Minister Donnelly in relation to this because this is something that we really need to move and I want to see happening, and it is going to be discussed in the context of the budget. And I would be hopeful that we will be able to bring this in. As I said, it means that those who have an income of €900 who are over 70 and they miss out on having a medical card, the threshold will increase to €1,050. I will be pushing this really hard myself, Deputy.
Deputy Cullinane.
I don't think those over 70 will take any comfort from the fact that this might be addressed again in this year's budget. And I don't doubt your sincerity in terms of your association with this issue. The problem is that last year, and I saw it myself in my own constituency, I saw it around the state, we had government TDs going around saying that this was one of the great things that they had in the budget. Over 70s, more people would get medical cards, 7 and 8-year-olds would get medical cards, and it hasn't happened. So we're now hearing it might happen, and it might be in this year's budget again. The fact is that the money should be provided to make it happen. We have, and I've had it myself, I have parents contact me of children whose children have reached past the age of 6 and are now 7 or 8, and saying, we were promised this. We were told this was in last year's budget. What's happening? The negotiations haven't even happened with the IMO in relation to this. Hasn't even happened. The Minister hasn't even started discussions with the medical organisation to see what can happen, Minister. And we need more answers. We need more clarity than may or might, given that this was something that was in last year's budget and voted on by this House.
On the next round, yes.
Not on priority, no?
Deputy, as you will be aware, I'm here representing Minister Donnelly, and as I said, I'm glad you accept my bona fides on this, because I have spoken to the Minister in relation to this, and it's something that we're very anxious to progress in relation to the medical cards. Currently, 75% of persons aged over 70 have a medical card, and if the potential beneficiaries up to 56,000 people materialise, then an increase in the income thresholds would result in over 88% of this cohort now being eligible for a medical card. It's an important health measure which will provide medical card eligibility to a greater proportion of people over 70. And all I can say here today is I will continue to push this with the Minister. You know, we are in unprecedented times. There's 600 million after being allocated today in relation to supports which will be seen in the next week or two. But certainly you have a guarantee from me that I will continue to push this.
Yeah, I'll just make the point again, Cathaoirleach, that this was something that was voted on last year in last year's budget. I don't think there's a TD in this chamber, government or opposition, who have not been lobbied and received correspondence from parents of children and from older people, and indeed the other issue I raised in relation to cancer patients and other patients with terminal illnesses who were promised that the issue of a medical card for them would also be examined and looked at. And those extensions of eligibility for the medical card was something that TD after TD on the government side, and indeed when Fianna Fáil were supplying confidence and supply and were taking credit for all the good things that they saw in the budget, but not for all the bad things. This was one of the good things. TDs were falling over themselves from Fianna Fáil to claim credit for the fact that children were going to get medical cards when they were 7 or 8. More older people will get medical cards, and it hasn't been delivered. It's been a broken promise. And yet we're now being told it might be dealt with in this year's budget. I'm afraid, Minister, if that's the best I can go back to the people that have contacted me with in my constituency, I don't believe on their behalf that that's good enough.
Well, I can certainly say, Deputy, that I was not one of the people that said that this was a done deal, because it was always cognizant on the fact that there would be a surplus in the budget in 2020 to deliver it. That was the small print, but you're like, who bothers with small print? But that was the small print that was written into it. And I was
that what they say at budget time?
I was very, very clear on that. So this was always dependent on a surplus. We're in unprecedented times. There is a pandemic. The Minister for Health has gone home because he is sick and he has to have a COVID test. So I just think we need to be very careful where we are. 357 people died today. Our focus has to be on COVID. Yes, I want to see the threshold extended. Yes, I will, during the estimates and during the budget, I will be pushing hard for it. I've given that commitment on the floor of the Dáil. I've spoken to Minister Donnelly. He wants to see the same thing happen.